On behalf of WellQuest Living, I would like to welcome you and thank you for joining us. My name is Tammy Cahill. I'm the Senior Living Advisor for WellQuest Living of Elk Grove. We will be talking to Laura Wayman, the Dementia Whisperer, our guest for today. Laura is a dementia expert, author of a best-selling book worldwide, published by Johns Hopkins University Press. She's a renowned guest speaker and trainer in dementia, educator and consultant to first responders, skilled nursing facilities, hospitals, clinics, home care agencies, as well as senior living communities just like ours. I personally have benefited by training with Laura over the years, increasing my knowledge of dementia and giving me a better understanding of dementia care. This has helped me to better assist families in need. Because of Laura's expertise, I called on her to share her knowledge in working with those with dementia to address concerns of our families as they approach the consideration of moving their loved ones into our community. So welcome, Laura. I'm excited to have you join me.
Thank you, Tammy, for that amazing introduction. And I'm sure you are getting many questions and concerns from family members, whether it's even safe to consider moving a loved one into a community such as yours during a pandemic. These are valid concerns, and I'm here to share some insights into these new challenges and share how your community is actively addressing them. Just to clarify, I'm not a doctor or scientist, and my input is strictly based as a consultant and a previous senior living advisor just like you, and an executive director of a memory care community, as well as a previous owner of an in-home care company. And I am an experienced educator and trainer in dementia care. You know, Tammy, let me first talk about the fact that infection and disease prevention is not new to the long-term care setting. For example, Tammy, isn't there a regulation that all potential residents must get a TB or tuberculosis test before they're allowed to move in?
That's true, Laura.
So let's discuss, why is that required?
Well, Laura, as you know, seniors are more susceptible to contagious diseases. According to the CDC, Center of Disease Control, the odds of being affected while living with someone with active TB is high. Active pulmonary TB is spread when the infected person coughs, spreading bacteria into the airway.
Okay, so this industry has already learned to take precautions to ensure that all residents are kept free from the threat of TB, and this has proven successful and kept the TB threat controlled. So the point I want to make is that we can and are taking these kinds of precautions to the next level, especially now that unfortunately we're faced with this new threat. So we all need to think of this in terms of how we can take this knowledge and expand on it until we get the necessary help from a vaccine.
You're so right, Laura. Many families need peace of mind knowing that we're taking all of these new precautionaries very seriously.
Tammy, can you share the following steps your beautiful community is taking to ensure your residents will be safe and protected?
We are utilizing all necessary infection and illness protocols to keep all of our residents safe and secure. To some extent, the coronavirus pandemic has impacted nearly everyone's daily lives across the United States. Seniors have been especially affected due to their increased risk of contracting a serious case of the virus. If you have an older loved one, COVID-19 may put you in a tough situation due to their health risk. Seniors need to be even more diligent about social distancing than the rest of the population. This distancing can make it difficult to determine how to handle your loved one's care while keeping them safe, especially if they require daily assistance. Senior living environment like ours at WellQuest that offer independent assisted living and memory care can still be the best option for many individuals, considering the enhanced safety measures senior living communities are taking like ours. Moving a senior into a senior community may make more sense than living alone and possibly not getting adequate care. I want to share with you that we are practicing all guidelines for cleaning and sanitizing our community and keeping the environment safe and clean. As well, we'll be doing all we can to ensure that residents are active and engaged in a safe, happy, and healthy environment. So Laura, how do I make our families feel better about placing their loved ones in a community under this situation?
I'd like to speak to my specialty in dementia care and dementia care approach methods, and then blend these with the infection strategies and preventions that you're talking about. You know, coronavirus spreads easily from person to person, and that's a phenomenon known as community spread, which makes apartment complexes and senior living communities an environment in which the virus could thrive. This makes a lot of people hesitant to move their loved one into an assisted living facility right now, even if their loved one needs this level of care. While senior living communities are implementing strict health and safety measures to prevent community spread, it may be harder to implement the same kinds of policies in your own home. For example, if your elderly loved one lives with you, someone who also lives in the home could pick up the virus while running errands and then unknowingly pass the virus to your older loved one. Or if the senior's main family caregiver gets sick, which is one of my biggest concerns, the family may have to make a horrible choice whether to potentially pass the illness on to their loved one or leave their loved one temporarily without care. I'm sure you will agree that would be so difficult to make that kind of decision. Additionally, there's the senior who lives alone who could be completely isolated for the foreseeable future as people follow these social distancing guidelines. This could present dangers for both physical and mental health. And when you consider the steps that senior communities are taking, such as enacting strict social distancing rules and other safety protocols, the fact that residents don't need to leave for essentials, and it brings about the point that your loved one would often be safer in an assisted living or dementia care community right now. Senior living communities also have several caregivers on staff, ensuring that the residents will not have to go without care in the event that someone on the staff is unable to work during the virus outbreak. So with that having been said, Tammy, why don't you talk about all this in mind, who's a good fit for residential care during the coronavirus?
Question, Laura. If your loved one is not currently living in a residential care facility, you may have put your plans on hold for now. But many seniors in senior living communities is still the right choice in considering to move them in at this time. In general, the following people are good candidates for senior living. Seniors who need regular assistance with active daily living, such as eating, bathing, or dressing. Seniors who live alone and have a medical condition that may require, urgent attention. Seniors who have dementia symptoms like Alzheimer's or any of the other causes that can make it difficult to follow hygiene protocols. Seniors living with other family members who are unable to social distance or isolate, such as medical professionals, grocery workers, or other essential workers. Seniors who live with a family member who have recently traveled internationally, as well as seniors who live at home with other people who are not isolating, and the senior does not have their own bathroom or bedroom to properly social and isolate.
And also, the staffing and changes in the care approach, it's very important for residents with dementia to keep their environment and routines as consistent as possible, while still reminding and assisting with the frequent hand washing and hand hygiene, social distancing, and if tolerated and safe, a cloth-based covering. It's also suggested, as your community plans on doing, to have designated staffing for memory care only when possible, as well as work to keep staffing consistent and limiting personnel only to those essential for care. It's important to provide structured activities, which unfortunately may need to occur in a resident's room, or scheduled at at staggered times throughout the day to be able to maintain that social distancing. It's crucial to providing safe ways for residents to continue to be active, such as having personnel walking with the resident or working out in the garden where possible. It's suggested that you limit the number of residents to an activity when feasible in common areas, and then gently redirect residents who are ambulatory that are in too close of proximity to other residents. I know, after talking with you, that your community will be cleaning often touch surfaces frequently, especially in hallways and common areas where residents and staff spend a lot of time. The importance of having a family member move into a community like WellQuest is that you have trained eyes on residents 24 hours a day to ensure access to necessary medical care and emergency services if needed, in alignment with the residents' care needs.
It's nice to know during this difficult time, Laura, that we can provide needed care to those with dementia. Just knowing that we can make a difference not only to our residents, but also to the families as well. Thank you, Laura. Together we can create a better life for the aging population with a caring approach and adhering to the new standards necessary to provide the best care for our residents. I love having you here with me today, and I hope that you will join me in the future for another meeting. I learn something every time we're together. Thank you, Laura, for devoting your time and spending this time with us. For more information on becoming dementia aware and/or on Laura's book, visiting her website, laurawayman.com, or visit her directly at help@laurawayman.com. For more information on WellQuest Living of Elk Grove, you may call 916-689-1000 or visit our website at www.wellquesteg.com. As a reminder, we're located at 8871 East Stockton Boulevard. We welcome your calls and emails, and we thank you for joining us.
Thank you for allowing me to be here. This was lots of fun.
I enjoyed it as well. Thank you, Laura. We'll see you soon.